Through the stories shared on the show, you will find real-life triumphs of adversity.
Triumph and adversity, inspiration and motivation.
Grab a hold of your life.
Grab a hold.
It's time to be determined to set your goals and achieve them.
Achieve your goals.
Set your goals high.
Set them high.
Reach for Mars. If you land on the moon, it's still a huge moral victory.
Reach for Mars.
Get ready to be inspired on The Determined Show, hosted by Mark Garman.
The Determined Show.
There we go. There he is. There's Dr. Olivo. All right, here we go. We're ready to rock and roll. Let's do this.
All right.
I'm tired of ad-libbing.
Well, thanks for having me on today.
Hold on. Let me throw you up top. Without further ado, the world-renowned, the one and only, the best neurologist in the world. Drum roll, please. Dr. Olivo. There we go.
Hey, thanks for having me on.
Hey.
It's a pleasure to be on a show that one of my dearest friends and patients has put together, and I think it's really beneficial for everyone to come together, and exactly what this show is named is determined to move forward and to push along. I also want to express all the thank yous to all the nurses out there, because this week is Nurses Week. And so I want to, say thank you to all the nurses. Thank you to my stroke coordinator there at Loma Linda for everything that she does, and all the other nurses I work with. Without any nurses, we can't do any of our jobs.
Oh yeah.
And they are the cornerstone of our healthcare system. So I just want to give a great shout out and a hug to all the nurses out there.
Yeah.
Social distancing hug.
There you go.
So thank you. I know we had some technical difficulties there, but thank you for having me on.
I was treading water, and I was almost drowning trying to stay afloat.
Yeah, that's what the island's back there for.
Right? I couldn't reach it.
Yeah. So thank you for everything you do. I've always been excited about people doing new innovative things to reach out, and just having you talk to different people from other countries. It's just remarkable. And I'm sure it's going to be very helpful to other people as well. I saw the interview with you and Laurie, and it was like really cheered me up. I was seeing it with my wife, and it's very nice seeing both of you guys. What you guys are doing is just phenomenal.
Oh yeah.
So thank you.
Yeah.
So let's move on to the show. What you have for me?
Yeah. So go ahead and you kind of touched a little bit on it, but go ahead and give a brief introduction of yourself.
Oh yeah. So my name is Dr. Olivo. I'm a practicing neurologist. I did my fellowship in clinical neurophysiology. I am the stroke director at Loma Linda University Medical Center, Marietta. I also work at Riverside Medical Clinic. As a clinician there, I see basically every single thing under the sun when it comes to neurology. Neurology is my passion. I love what I do. I love the people that I see and I interact with, and everyone's different. Every stroke is different. Every person's different. And I always tell people is we don't treat a disease. We don't treat a stroke. We treat the person. And it's always challenging. It's never easy. Every situation is different. But thank you for having me on. And my heart goes out to everybody in New York. I'm wearing my so I got this Elmer's Hospital from my intern year for Doctor's Day. They gave us a lab coat, and so when I seen COVID-19 and Elmer's Hospital getting hit so hard, it really hit dearly to my heart, because I still know a lot of attendings there and people there that are in New York and in the front lines. So a big air hug to them as well for what they're doing, and for the accomplishments that they're doing too. Things are improving. So, and I know that's a fresh hot topic.
Yeah.
That everyone's diving in, but my specialty is neurology. So
Right.
I tend to deviate from that and leave the majority of those questions to my infectious disease colleagues and other colleagues that are treating it day by day.
Right. But in essence, I mean, you do know how COVID-19, does affect a stroke patient, right?
Absolutely. So
Okay.
there's, COVID-19 right now,
Well,
high alert for neurology. I won't deviate from the topic, but high alert from neurology. All neurologists has it on the radar of what cerebrovascular and other neurological symptoms can present. So it is something that it's on our radar. It's something that I talk to my colleagues on a daily basis, and it's something that we've had changes even in our healthcare system or in our hospital system to try to help expedite care.
Awesome. Maybe we'll touch on that at the end of the show.
So I know you wanted to start talking about the different types of strokes.
Yeah. So what are the different types of strokes that we have, Dr. Olivo?
So we could break it down in many different categories, and the two big categories are hemorrhagic and ischemic stroke. If we break it down to those two categories, the majority in the United States have ischemic strokes. The vast majority, greater than 85%.
Yeah.
Those numbers will fluctuate. And then with 15% plus or minus, will have a hemorrhagic stroke. And those could be subarachnoid hemorrhage or other type of intracranial hemorrhages as well. And the ischemic stroke categories, those usually classify in two different ones. One is called a transient ischemic attack, TIA. You might hear people say mini stroke. Well, there's nothing mini about having a stroke.
Right.
Well, there's really nothing. It's more like you're lucky that you're not having residual symptoms for the stroke, but there's nothing mini of having a heart attack or a stroke, right? And then the ischemic stroke is when there's a clot in one of the arteries. And so when it comes to stroke awareness, most of the emphasis is towards ischemic stroke. I know we talked about FAST, and what that stands for, and the awareness when it comes to stroke, and the time to get to the hospital. It's very important to recognize the signs and symptoms of the stroke, but not every stroke presents the same way. And so, the face could have asymmetry. You could have weakness in the arms. There's different manifestations that happen in a stroke, balance problems. One of the big caveats on a stroke is knowing that something changed from one time to another and it's just not right. And I always say it's mom's instincts. If mom feels like something's not right, you should probably see the doctor. And so I'll never argue with my wife about one of my kids needing to see the doctor, because her instincts are 10 times better than mine.
Well, I mean, if you don't mind sharing, your wife is also
and plus my wife's a neurologist as well, so we complement each other quite well at home. So we just we're constantly talking about neurology, but also, as what's coming to our life is a newborn. So we have a 1.5 week old. So we're juggling everything right now, and it's fun times, but definitely different background with all the things going on right now. So so again, mom instincts is very important. See something acutely changed that doesn't seem right. that's obviously a signal, and that's more the signal in the younger population. The older population, you might see a classical stroke symptoms. Some people miss that are very common is when people have language deficits, when people can't say the right words or say a bunch of different words that doesn't make sense, and they just say, "Well, she's confused. She woke up. Maybe it's her dementia, or maybe she's just confused today." And it happens to be a large stroke in the language center. And so those are ischemic strokes. The reason for ischemic strokes being so important to recognize in a timely fashion is because of the treatments that are readily available. On the same token, hemorrhagic strokes are just as important or even more important. More people, it has a high risk of dying from a hemorrhagic stroke. So,
and why is that? Why are the risks higher?
The risk higher immediately is because, the other day my wife calls me into the laundromat because in the laundry room because one of our pipes bust, and in seconds it starts flooding, and that's essentially what could happen in a hemorrhagic stroke. One of our arteries ruptures, and just blood starts pooling. And we have a cranial vault, right? So it's a system that's made for nothing to get into. However, it starts building pressure because it's a closed system. And because of that pressure, it puts pressure on the other parts of the brains. And, people could die relatively quick because of that. And so it's so important. And some of the signs and symptoms for a hemorrhagic stroke are different. It's, someone has a headache, for example, a severe headache. In the back of every neurologist or every ER doctor is subarachnoid hemorrhage.
So the fast wouldn't apply to this stroke then?
Not necessarily, yes. Yeah. So I guess that's a big thing we sometimes don't recognize is strokes are diverse, but the fast doesn't apply all the time. And I think that's very important. Again, that mom instinct, if you have your kid and they're complaining of the worst headache, you can't concentrate, can't eat, and you see them staggering a little bit, most moms are just going to say, "You're going in. I don't care what." Some dads might be a little hard-headed or whatnot.
Shake it off, kid.
That mom instinct is what gets you. And I always say the very first person when it comes to a stroke, the stroke team, meaning the care team for a stroke, is the person witnessing the symptoms. Because they're able to tell us what's happened. Sometimes someone has a hemorrhagic stroke, they're already passed out by the time they get to the emergency room. So we're really relying on that very first person that's able to tell us exactly what's happened. Or another instance, they might have an AVM, arterial venous malformation, and that started bleeding out of nowhere. They didn't even know they had that, and it started bleeding. And the first manifestation might have been a seizure. It could have been a focal seizure on their hand. But again, the mom or somebody that was really alerted noted that something really was odd and something was really different, and got emergency help real quick. And those strokes, time does matter because it could be the difference between life and death. And it's a scary process because you see a quick change really quick in someone's status, and you don't know what's going to happen. And you could talk firsthand about your own experience and what the person that first saw you felt, but as a physician, as a neurologist, we have the benefit to actually talk to somebody to find out what's happened, and that kind of clears up the picture. We also have the technology on our side, right? That's why we get CAT scans so readily, so quick, because the first thing we do for a CAT scan is see, did this person have a hemorrhage? Because if they do, it's a complete different treatment than ischemic stroke. If they have a hemorrhage, we're going to have a neurosurgeon on board right away. We're going to have an ICU team on board right away. We might get some medications to decrease the pressures. We might do some intervention to decrease the pressures. We might, we're going to monitor their respiratory status like a hawk. We are going to do everything possible to make sure that they have the best possible outcome as well. So it's so important to be able to differentiate things in a quick manner. Within 15 minutes, someone goes to the hospital and there's a suspicion of a stroke. We already have an idea: is this a brain bleed? If this is an ischemic stroke. And then in the next 15 minutes, we have to decide if they're ischemic stroke, if they're going to get a medication to break up a clot that has a 6% risk of bleeding in the brain. That also has its risk, but we also weigh out the risk versus the benefits.
Yeah.
And I know that you have people that's probably on your show that have some of those medications. And after that, sometimes we go in and try to retrieve the clot if there's a clot in one of the larger arteries within the brain. And so, I've had great outcomes, or I've seen great outcomes with a lot of patients and all those different things. And there's a potential risk to all of that as well. But going back to the hemorrhagic stroke, it's really a time fashion to get treated, and even then, sometimes everybody could do everything, and it's just hard. It was in a very vulnerable area of the brain. So if you're able to survive that, if you're a person that's on the show seeing this, that means you are light years away of what could have been, And so the true healing happens after the hospital, what a person has to do on their daily life, what they have to look forward to the next day, where they gain inspiration from, what their goals are, and then also feeling content within themselves. I think that's very important. And as a neurologist, we try to guide that, but the pillar is a person that went through that whole experience, and their family. Their family is the supporting cast, and that's the truth. So it's very hard.
So my good friend here, George from Australia, had a hemorrhagic stroke, and he was actually in Greece when he had it, and his whole left side, I believe, was affected, and I think it was 2 years ago when he had it, and he's working on his recovery. He's getting spurts. I think he said he was at 30%. So they're giving him like a percentage of like how much usage he has of his body. How do you guys like mitigate, like what percentage you guys have for the usage of your body?
So a lot of times we get a baseline from the physical therapist. The physical therapist gauge from the very beginning, when you're in the hospital and then leaving, what your functionality is with your examination. As neurologists, we do too, but we don't measure it when it comes to strength and conditioning. We have a graded system. Some do it 0 to 5, some do it 0 to 5 for motor examination. That's the standard examination that a neurologist will have: put your arms out, put your pull, and push. And in physical therapy, what they will do, sometimes they will have certain devices to actually measure how strong you're pushing or pulling or gripping, for example, and they'll give that. And sometimes we're just giving a ballpark figure of what that estimate is. I've seen people, on my exam is 5 out of 5 in all their strength, but they don't feel like they're 100%. And so that's two different things, right?
Right.
What we feel and what someone else is grading someone on. It's kind of like, someone feeling like they did super great on a test, and they really did. So sometimes there is a discrepancy of how we feel and how the test is, and we would love for that to match, right?
Right.
Love for that to be, the B's and A's, and feel really good about it as we go on with recovery and as we move on too, as well. So it's, when it comes to hemorrhagic strokes, for example, there's the different forms, like I said, from a vessel, it could be from an aneurysm. An aneurysm is a weakness, an outpouching from one of the arteries that starts getting weaker and weaker, and with blood pressure, there could be a rupture. It could be from a traumatic head injury. Someone hit their head. I had a patient, say within this last month, that had a fall, that was on the ladder, had a fall, didn't even know that it was that bad, but ended up having what we call a traumatic subarachnoid hemorrhage. Ended up having a seizure as well because of that. And so it's it's very complicated within the strokes of the different types, and trying to investigate why that person. I think that's, in my mind as a neurologist, that's what really gets me motivated, is always trying to figure out what's that why. Why is that person like that? Is there something else that I could do for that person? This person has had, for example, when I saw you've been diagnosed for how many years?
Since I was 15, and then when I saw you, it was guaranteed that I'd have a seizure every 8 weeks. When my finals, when I'd have my finals were every 8 weeks, and it was guaranteed that when the stress would come from my finals, that I would have a seizure. And the neurologist that I had before you was basically told me, it's normal. And I said, no, it's not normal. Like, that's ridiculous. I'm gonna go find another neurologist. So here comes the knight in shining armor, the best neurologist in the world, some guy named Dr. Olivo, and you switched up my medication, and I had a seizure in 3 or 4 years, something like that.
Yeah,
So
well, again, the first person that made that switch was you. So you're very determined to get better. I think you have to acknowledge yourself. Exactly. You have to acknowledge yourself. There's a thing called doctor shopping, and after a while, like getting the same answer for multiple doctors. But there's also a thing of just being with one doctor for a long time, and it's okay to get a second or third opinion. It's okay. I never get my feelings hurt. Actually, I encourage it. If I can't, or I sometimes. If I don't have anything to offer, I don't have those higher resources available, by golly, I do send it to one of my colleagues, usually at a tertiary care center that has multiple tools available to help out. Lori's a sweetheart.
yeah.
But your example is very classic, and I'll tell you, it could have not worked, but it's worth a shot of trying something different, trying a different medication regimens. I've tell you, I've when it comes to seizures, I've had certain luck with certain patients that been able to find the right combination of medication, and also takes the patient too to have confidence in you that they're going to be compliant on their medications, right? Because, for young folks, compliance of medications for seizures are such a big deal.
Yeah.
And it goes hand in hand. And sometimes it's the young folks, and sometimes it's their parents being scared that they're on these medications as well. And so sometimes it's education to the family, to know what's out there, and to know what medications are out there, newer medications, older medications, what their side effects, etc. And sometimes we have dual benefits of some seizure medications, such as mood. Sometimes some of the medications could be mood stabilizers, and they could be great seizure medications as well. some of them could make mood worse, and you want to avoid that for our seizure patients that might have mood issues, especially after a stroke. So it's very, very important. So that's huge. It's always looking for something to improve yourself. Another thing on, besides seizures manifesting in hemorrhagic stroke, another thing that people don't realize, one of the biggest risk factors for hemorrhagic stroke is blood pressure, uncontrolled blood pressure. So blood pressure is a silent killer. People could be walking around with 180 blood pressures and they don't really know it. And most of the people that have these large hemorrhagic strokes for blood pressure usually didn't get their primary checkups routinely, or didn't know what their blood pressures or their risk factors were for stroke. So someone that knows their risk factors for stroke prior to having a stroke is one person that is really trying to prevent it. Obviously it goes with exercise, nutrition, and all the other different facets. But knowing, kind of looking yourself in the mirror of knowing where you're at physically, medically, with blood pressures, your cholesterol, your sugars, is really important. And also knowing your family background, your risk factors for family, and if there's any other things that could be a risk factor as well. So, for example, someone that has an aneurysm, they have family members that's had aneurysm. They should be proactive and talk to their doctor about that, because they'll likely refer you to a neurologist or a neurosurgeon so they can look at your arteries in the brain and make sure you're not having one. So, pre-treat you instead of something happening really bad. So those things are super important to find out what your risk factors are for certain things. When it comes to younger people, for ischemic strokes, it could be all different things that could increase their risk. It could be a young a lady in their 30s, for example, that's on an oral contraceptive, or that has a higher risk, and they have migraines with auras, can be an increased risk as well for ischemic stroke. So there's all different things that we call hypercoagulable states, things that thicken up our blood to make it clot faster. There's all different factors that happen for it. So when a young person comes in for a stroke, we look at those different things. We look at potential things that the other oral thing that we put in our body are toxins sometimes. I shouldn't say we, I don't, but those that I definitely don't. But those that do drugs, unfortunately, that's it's a large population that does methamphetamine, for example, and it's heartbreaking, because here you see people not just having bad teeth, but they're having a bad brain too. We look at their brain and it's like, wow, you're only 40 years old, but your brain looks like you're 80. And so drugs is a big problem too when it comes to stroke. I definitely fall more in the risk category of always trying to stay away from the culture foods, and also as a physician, especially now doing tele and doing all these different ways that we're doing it, starting to sit down more. I started telling my wife, I do not like tele medicine. I like seeing patients. I like standing up, pushing on them, moving around, because I really do need to move around during the daytime. So sedentary lifestyle also raises that, and so it's so important so people to get their quote unquote steps in, and get their exercise regimen to get their heart rate going, both for stroke prevention, for memory prevention, for all degenerative diseases. In fact, there's great research that shows that exercise and nutrition really does help out. So those are the major types of strokes. The big categories: ischemic and the hemorrhagic. The bleeding, and you could think of the ischemic more of like the heart attack, that were something clots. So those
the
are
vessels. Yeah. So you did kind of touch on it a lot actually, but I researched, the different types of strokes quite a bit. And as far as when a child has a stroke, especially a younger child, I researched that extensively. They don't know how to communicate with their parents, like, hey, I can't, there's something wrong with my affected side. Hey, my speech, or I'm feeling dizzy or confused. So, you were talking about a mother's intuition. So if they can't relay these types of things to their parents, what what type of signs can the parent look for?
Yeah. So again, the big sign is from one moment to another, something remarkably has changed. And it sometimes doesn't even have to be remarkably. It could be something very subtle that's picked up. So it could be someone slurring their speech. It could be a kid being more clumsy. They're used to playing baseball, or they're playing with their young siblings outside, and you're just falling down. They're sitting on the stool, and kind of like, he's not usually clumsy. What's going on there? Or people don't realize this, but we could have, pregnant moms. The womb, the baby, the fetus could have a stroke.
Wow.
And even then, sometimes the mom could feel something's not right. The baby's not moving all that much. So talk about mom intuition.
Yeah.
It's really huge. So you could have a stroke even in the womb. So yeah, definitely. Those are some of the things. Someone walking or running, not sitting right, not focused. They're trying to put on something, and they just don't know how to put on their jacket or their clothes, and that's not them. They're brushing their teeth, and they brush half of their teeth, and what's going on with them? Why didn't you brush another?
Right.
Ignoring one side of his body, for example,
or
bumping into the walls, or you notice that the vision automatically changed real quick. Not seeing one side of the room, for example, or seems very inattentive out of nowhere. He was very happy-go-lucky child, and something did change. And this could be a stroke. This could be some other type of neurological process, but most likely it should be treated,
evaluated. Yeah.
SAP, stat, or urgently.
Yeah.
So definitely those are the things to be on alert. As a parent, those are the things that scares us, right? Anything that changes to our kids, or even right now with my week and a half year olds, I look from afar, and I talk to my wife. Okay, is he doing this? Is he doing that? We look at milestones, for example, for neurological process. Are they hitting their milestones? Do they regress on their milestones? That could signify that. But definitely for a stroke perspective, it's usually something that's more acute. That's quick, ongoing. And they could also have headaches too. So they can have that subarachnoid hemorrhage as a kid that's having a really severe headache. And the way that they're expressing it is not by saying, "Mom, my head hurts." They're crying out of their eyes, and they're just not able to stop crying. Or they're holding onto their head, and they don't have their language abilities that well, so they're expressing it more. And so those are some of the things that children, how they can display signs and symptoms of stroke. And obviously there's the more terrifying processes where someone just collapsed as a kid. Kids are completely different.
Yeah.
In terms of brain care altogether, we really take it seriously. I think we've changed the way we approach protecting the brains for kids, especially when it comes to concussions and other things as well, because it's so valuable to protect it from secondary injuries, for example, and concussions, and diagnosing it right away and making sure you see the right type of provider for those injuries. So it's very challenging.
Mm-hmm. So we're actually not going to answer this question, and I will discuss why. So Lori asked here, so are we considered a stroke survivor's person with underlying medical conditions as far as COVID-19? So Lori, we're not going to answer this question because actually Dr. Olivo and I are going to jump into a show. It's probably not going to be on Thursday because I have a scheduled guest. So we will probably do one prior to the Thursday. But we're actually going to talk about COVID-19 and the relation of a stroke and how it can affect people with strokes. So to answer that question, you will have to tune in to our next show. And so we're going to go ahead and open this up to Q&A, but it cannot pertain to your medical condition because he can not answer that. It has to be a general question. Right, Dr. Olivo?
Yes.
It has to be a general question. I have a general question for you, Dr. Olivo. So this is actually not from me. It was from a friend of mine. When you have a tingling sensation on your affected side, say, for instance, like you go to scratch yourself and it tingles, or you go to cut your hair and it tingles on your affected side, why does it do that?
Well, you still have messages from your brain or connections from your brain coming down to your affected side. So it's actually a good signal, right? You're touching yourself and you're getting a response. So it's actually a positive sign that you're getting some type of response. So whether you're stimulating yourself by touching your skin, but that sensation is actually a good thing. Some people after a stroke, for example, in certain parts of the brain, they could have a numbness that turns into pain.
Oh, wow.
So and so that can happen. It's very the sensory nervous system can be very tricky. And so when we look at the sensory nervous system, we talk about centrally within our brain and then peripherally the nerves outside of our brain. People have a stroke, the nerves outside, they know it's completely intact. And then inside the brain, depending where or how much it's been affected, and depending on, are they building new networks, etc., some of that sensation definitely can come back. And it could be a percentage. It might be 50%, might be 20%. Someone might have not feel anything, but for some reason they stimulate them a certain way, they start feeling something. Those are usually positive signs.
So what caught my attention was, you said new connections. So I know that the brain is a wonderful thing. It can reconnect from, say, it has a pathway to a certain part of the brain, and that pathway is disrupted. It can find a way to go this way and that way to reach that pathway, correct?
So there's a thing called neuroplasticity, that our brains can form new pathways. The younger you are, the more chances you are to build new pathways, right? There's also a thing to strengthen up some other areas of the brain to compensate for that area, or to get those to be awake. A great example is, for example, someone has a hard time processing language because they had a stroke in the language centers. And they have a hard time expressing themselves, but they're able to do it to melody, to a rhythm, to a song. They're able to open up another pathway into the brain. And if they're able to tap into that center and really focus in there, they could actually prove a lot more than they would otherwise. So it's the brain is just
It's amazing.
It's just amazing. I've seen patients that, and that's why I always say you don't treat an image, you treat the person, because you could see an image and be like, oh my gosh, that person only has this much brain. And literally, I've seen a brain look like a moon shape on someone, and the person had a PhD degree. And it's just like, wow, that's just amazing how someone's able to compensate and live a normal, essentially quote unquote normal life, and overcome so many different obstacles. And then there's certain strokes, for example, that could be in a certain, I had a patient that had a stroke in a certain area of the brain that caused a stroke that she couldn't recognize faces.
Oh, wow.
So if she saw her husband and other people around, she couldn't recognize her husband's face. She would recognize her husband by what he was wearing, but not his face. It's just such a very interesting phenomenon. So it's, stroke is it's tough. If you do have one of those, definitely that's tough. To have a stroke in that area and not be able to recognize. But she was determined.
There you go. Love it.
She's also a very inspirational person as well. That's done a lot when it comes to speaking and different engagements as well. So I'm just amazed of all the talented stroke survivors that are out there and doing so many amazing things. It's phenomenal.
Yeah, I mean, that's one of the things that brought me here is, I never thought of myself as disabled until the business community deemed that I was, and then it was kind of like a slap in the face, like, oh, I guess I am, But Leanne here asked, how much time does a person have to get the clotbuster medication for a stroke?
Yeah, so Leanne, the all-star stroke coordinator there. Number one, let's clarify. It's for ischemic stroke, right? Someone that's having an ischemic stroke. And we always say time is brain when it comes to stroke. So once you find out that someone's had a stroke, it's just like the clock is ticking. How fast can we treat this person? So to answer how much time, the earlier the better. That's the amount of time. But for them to get that medication to break up the clot, the window, what we call it, the TPA window for that, is 4.5 hours. It's approved by the FDA for 3 hours. 4.5 hours is basically the American Heart Association guidelines that we push it out to. So generally, I don't want to speak for every hospital system in the United States, but it's pretty common practice for 4.5 hours right now. And with that, we are also assessing if they have a large vessel occlusion, meaning that within their large arteries, there's a blockage there that we could potentially go in and try to retrieve a clot with the stent clot retrieval device that are readily out there now. And so it's a very complicated process, and most hospitals are stroke hospitals now because they have identified that as a need to do.
How is the window administrated student? So it's not really a question, just more of a shout out from Salud. She said, OMG, thank you, Dr. Olivo, for talking about exercise and the need for preventive measures. My husband had a massive ischemic stroke in 2015. He was in the window to be administrative TPA. He is determined to keep moving forward.
Yeah, that's beautiful. So that's a patient that was in the window for TPA that received it. And the reason we give TPA is long-term. It is studied long-term. Patients did better that received TPA than those patients that did not. So we want to give everybody the opportunity to have the best outcome. Provide the tools. Again, at the end, it's her husband that's really pushing forward. It's motivated and determined to overcome the obstacles in front of him. It's so important to realize, those signs and symptoms of a stroke, to be able to make it there on time, because the time starts when the stroke started, right? And so sometimes we have patients that wake up with a stroke symptom. And so we go by the last seen normal, and then we have advanced our technology so much that now we're able to look at imaging and see, well, this person probably had it recently and probably have an area of the brain that we could actually save. Let's send them off. Let's send them off to Loma Linda main campus, into a comprehensive stroke center that has clot retrieval device, and let's send them their stat. They'll airlift them there. They'll get them there as soon as possible to try to give them the best chance for recovery. And that's our goal, is, again, to identify and to give people the best chance of recovery. And sometimes it's very challenging. Sometimes it's not very straightforward. And I always tell Leanne, stroke is not black and white. There's a lot of gray in there. And again, that's our responsibility, is to try our best to figure that out. To try to figure out, is it just a stroke? Is it just something else? There's a lot of stroke, what we call stroke mimickers, things that look like a stroke but aren't really a stroke. But again, that's for
Go to the hospital.
Exactly. Go to the hospital. Put the pressure on us to try to figure that out. You guys did the hard work by identifying and getting someone on time. So, Salud. It would be interesting to know if she was the one that picked up the stroke, and because again, she was the very first one to identify and be part of that stroke team. She was the first person to hold that baton and to get it. And it's usually the first person and the last person that wins the race, right?
Mm-hmm.
Relay race. So in a stroke team, the first person is usually the family member, the wife, the parents. They're the first person with the baton, and the anchor is actually the patient. The patient's the anchor. The patient's the one that really takes it home to be determined to have the best outcome out there. Okay. and so it's so important to know that everyone is a crucial part of that. It really takes that whole team to hold that baton. You might have it at the same time at some points, but it's really that patient's the one that's going to take it home with their supporting cast at their house as well, and never be satisfied. There's nothing wrong with staff. There's nothing wrong with pushing forward and pushing yourself forward, because we're all going to age. We're all going to sit down, and we're all going to have to keep on pushing forward too. So whether you have a stroke or not, this is life. Our life is all about pushing forward and trying to push ourselves to the best possible. And those goes with the exercise again, and nutrition, and those factors that you gotta avoid the Q15 that they talk about, the quarantine 15. Actually, my thought process is people are actually doing healthier now that their family's cooking, and they're eating their foods a little bit better, and they can't have that excuse to go to a fast food place, etc. But it's very important, during this time of COVID-19. Again, I'm not going to COVID-19 right now, but during this time of COVID-19, it's so important not to be afraid to go to a hospital, or to go to a hospital for anything. The hospital right now posted something on social media stating about the complications of something routine that could get complicated because it wasn't taken care of. So seeing your primary, making sure you follow up if you have a question regarding, or seeing going to the ER if you're having these symptoms of a stroke. Don't say, hopefully it'll go away. I'm having some numbness and tingling on my body and just a little weakness on my grip. Hopefully I'll wake up better. I've seen one too many stories that a person has those type of things. They wake up the next day and not able to move. And it's heartbreaking. It's heartbreaking because, you could have provided some tools that they could have had some potential improvement.
Yeah.
Regardless, wherever you're at, whatever your story is, you gotta draw your line in the sand and move forward and push forward as hard as you can.
100%. As I don't know if you caught the intro or not, but in my intro it says set your goals high. Reach for Mars. If you land on the moon, it's still a huge moral victory. That speaks measures right there. So
I see Nicole right there just reading her comments that she had endocarditis.
Yeah.
And so I don't know if most people don't know what endocarditis means, but it's an infection in the heart. So you can have an infection in the heart that could draw little clots up to the brain as well. And so another reason for ischemic strokes, besides just the arteries coming in closer and clotting up, is clots coming from the heart. Can be from infection. More commonly, it's from a thing called atrial fibrillation, irregular heart rate. So we typically see this in older patients as well. Younger patients sometimes can have a hole in their heart, and they have a
She's going to be the one that we do next week together.
Oh,
yes. So she was the one that was playing soccer when that happened.
excellent.
Yeah. She's going to be our guest next week. So we are at 62 minutes. So do you have any concluding thoughts for our guest, Dr. Olivo?
I just want to say I'm honored to be on here because this is a great platform for each other to support one another and to learn from one another to push forward. Just thankful for you including me in this, and for all your guys' hard work and supporting your show and Determine. I really like the logo and all the things that Determine stand for, but it's something incredible that we have as humans. Is when we hit a wall, we know that wall is penetrable, and we're able to surpass it and overcome things. But we can't do it without other people helping us along the way. So don't be afraid to reach out for help from one another, especially during these times of social distance.
Heck yeah. All right. So as always, I'm going to conclude this with a prayer. Dear Heavenly Father, thank you for having Dr. Olivo come on and drop knowledge on everyone here and sharing with everyone the trials and tribulations of what everyone goes through when they have a stroke, and spreading the word for them to understand more on what a stroke is and giving them a better understanding of what they went through. And hopefully they can gain strength pushing forward. In Jesus' name we pray. Amen.
Thank you.
Thank you. Don, sorry we didn't get to your question. Dr. Olivo is going to be on again. We ran out of time. We'll be on again together. We'll catch your question next time, Don.